Human thumbs vary widely in their size, shape, and contour, and we're not able to measure around the thumb because it's attached to the hand. So instead, to determine the size of the MetaGrip, we take the tape and we put it just proximal to the metacarpal phalangeal joints. On this young lady, we can see that she's just over 7 inches, 7¼ inches. And if we then look at the sizing chart, we see that she would wear a size 1. The MetaGrip comes in 3 sizes: size 1, size 2, and size 3. This represents small, medium, and large sizes. The aluminum insert allows each of these to be adjusted specifically to fit the size of the thenar muscles of a specific patient. Now, what if a patient's measurements fall in between the sizes, right on the line between the 2 sizes? Well, if that's the case, there's really no good way to know exactly which size is the best without the patient being able to try on both sizes. You want the thenar area to be snug, but you do not want the rest of the MetaGrip to be restrictive to the patient. So a trying on is by far the best way for a very precise fitting. One easy way to determine the correct sizing for your patient is to have one size 2 that you keep in your clinic. Let's show you what we mean. This young lady, whom we just measured as being just over 7 inches and therefore a size 1, we could determine that she needed a size 1 by allowing her to try on this size 2, because we'll see that it's simply too large for her. So we open it up and she tries on the size 2, and you'll notice that as I fasten the straps, we can see that they're actually much too long for her and that she's loose everywhere here. So this, even if I were to squeeze the metal, is still much too large to really stabilize her metacarpal area. That way, if you do not stock the MetaGrip, you could appropriately advise her to order a size 1, and you would know that that's the correct size for her. If, however, this size 2 had been difficult to get on and it was much too tight, she would know that she would need to order the larger size or size 3. Now, many clinics are not able to stock devices for patients, and patients can order this directly from handlab.com. But it is really helpful if the patient can see it, try it on, and know exactly which size to order, because as we said, the circumferential measurement does not really measure the thumb.